My name's Kim. I'm a student nurse, and I'll be following you around tonight. Is that okay?
Sure, that's fine.
Can I have SBAR for your patient, Ronald Jarvis?
Yeah, Ronald Jarvis, he's a 67-year-old male, admitted yesterday for a diabetic sore on his right heel, stage 2. It won't heal properly, so he's here for treatment. He's not complaining of much of anything else, besides he's been having a little bit of high glucose readings in the last recent months. His normal blood sugar runs around 120s. He's a type 1. He's on a long-lasting insulin as well as a short-acting. His A1C did come up since the last 3 months. 3 months ago it was 5.2%, and recently it was 6.5%.
Mm-hmm.
He denies any dizziness or lightheadedness, blurred vision. Pupils are equal and reactive. All neuros are intact. Nothing outstanding. No known allergies. He's on an 1,800 calorie diet with a 2-gram sodium restriction. And of course his diet is a diabetic diet.
Okay.
So we're going to be administering the glargine and the regular insulin today.
Okay, and why is the client receiving this medication?
Well, he's a type 1 diabetic, so his pancreas doesn't produce any insulin at all. So the glargine is the long-acting insulin that will kind of balance him out, and the regular is a short-acting, and it's going to compensate for food.
Okay, and that's the action that it has on the body?
Yes.
Okay. So when should you question administering this medication?
Well, you should question if the blood sugar is too low. You should not administer either medications. So below 70.
Okay. Do they have a therapeutic serum level?
Nope.
Okay. And what about the vital signs? What ones should you monitor?
Definitely the blood sugar, and you should also look for physiological signs and symptoms of hypoglycemia, like being diaphoretic, and tachycardia, confusion, altered mental status.
Okay. And what interventions should be taught in the hospital?
Asepsis is important. Assessing the patient, hand washing, make sure that check the 5 medication rights, right med, dose, route, time, and patient. Checking to make sure that the insulin is intact, no mixing the insulins together, the glargine and the regular.
Okay, and what about when he's taking it at home? What should he know?
Definitely about not mixing the insulins. That's very important because it could, the glargine could break down the other insulin.
Okay. What are the side effects and potential adverse reactions?
For insulin is just hypoglycemia, and being unaware of being hypoglycemic would then lead to coma.
Okay. And how will you know if this medication is effective?
A normal blood sugar reading after administering.
Okay. Cool.
Administering.
Well, thank you.
Mm-hmm. All right, so now let's administer the medication. I'm going to check the order that the patient, Ronald Jarvis, is going to receive the insulin glargine at 1,600 on Tuesday. 18 units for the glargine, and the regular insulin is on a sliding scale for 1,600 as well. And based on his blood sugar of 242, he's going to receive 16 units.
Okay.
Get that out. There it is. I'm going to, of course, check the insulin with another nurse since it's a high-risk medication.
Okay.
And hand hygiene. Let's go see Mr. Jarvis. Hello, Mr. Jarvis. How are you?
I'm good.
I'm going to be administering your insulin glargine and your regular insulin today. Do you have any questions?
No, I've been taking a long time.
Okay. Can you verify your first name and your last name and your birthday for me, please?
I'm Ronald Jarvis, and I am 67 years old.
And your birthday, please.
I'm 67 years old.
Okay, birthday, got it. Let me see that. Oh, yep, that is correct. Good. So you don't have any questions about the medications or anything?
No.
Awesome. Let me draw these up. You see your bracelet? Just gonna reach. There we go. Okay, let me scan your bracelet one more time. Well, technical difficulties. Third time's a charm. All right.
Those computers sometimes.
You know, there's the glargine. All right. Oh, look at that. Blue gloves today.
Yeah, I like that. They're such nice colors. Makes it a little cheerier.
Yeah, that's right. So that's a regular glargine. 18 units. And I'm just going to confirm with another nurse. 18 units, 18 units. Beautiful. Alrighty. I'll have to do the other one separate. It's not going to let me do it at the same time. Okay, Mr. Jarvis, here's the first one. Where was your last shot?
In my arm.
In your arm.
But,
Okay,
you
so
know, my belly would probably be a good spot.
perfect. Yeah, it's important to rotate sites to avoid lipodystrophy.
Yeah, I think the nurse said something about that the other day.
Alrighty. Little poke. And right in the sharps. Alrighty, I'll be back with the regular insulin in just a second.
All right.
Why isn't this working? I know it won't let me. Let me time that. I think it's frozen. It's not green. Oh, I didn't verify. Okay. Apparently. Stand by. Let me see your bracelet one more time. Why isn't it working?
They've been having nothing but
There it
trouble with
goes.
those computers.
Yeah, I overheard the IT guys in the hallway, and
Right?
they're still having some trouble with the new program.
Problem solved.
That's good.
Save. think 22 is what it says. Stand by. All right, it took it finally. All right, let me scan your bracelet for the other insulin.
Alright.
One more time.
I know, those computers, wow.
Seriously. Yay! That one was easier. Okay, so I'm going to draw the regular insulin up. And I'm verifying the dose one more time for 16 units based on the blood sugar of 242.
Yeah, it's been a little bit high.
Why do you think that is?
I don't know, I mean, I haven't been quite eating as good as I should. My friends got me some donuts the other day, they were really good.
Yum. Let's see, 16 units. So you know that simple sugars are really not good for you when you're a diabetic.
Yeah, they just, they taste really good.
They do taste really good. They do have diabetic treats at the grocery store.
Really?
Mm-hmm. They have a whole diabetic section.
I should check that out.
Should. Okay, I'm gonna verify with the nurse. 16 units. 16 units. Beautiful. Alright, I'm gonna change my gloves. Hand hygiene. A lot of gloves.
I'm just glad knowing everything's clean.
Mm-hmm. Alright. So let's put this on the other side of the abdomen. Clean it. Little poke. 1, 2, 3. Sharps. Alrighty. Okay, all documented up. So here's some information that I want to give to you about diabetes and food, so that we don't have high blood sugars anymore, or at least try to control it a little bit. So it'll tell you about using vegetables as carbs instead of donuts and things like that. Here you go.
Thank you.
Mm-hmm. Alrighty. Bye, Mr. Jarvis.
Goodbye.
I'll be back soon to check your blood sugar, and your food tray's on its way.
Oh, good. I'm hungry.
Okay, that was nice. Thank you for letting me observe you. Were there any pertinent pieces of information you reviewed before administering the medication?
I did. I reviewed that it was the right dose for the right patient. I reviewed the doctor's order. I also reviewed the results of the blood sugar and the sliding scale to decide on the dose for the regular insulin.
Did this information affect your decision to administer the medication?
Well, I was going to administer the medication, but it did affect how much of the regular insulin I used.
Okay, and did this information affect how you administered the medication?
No.
Okay, well, that's all I have for today. Thank you.
You're welcome. Come again.